Parkinson's disease is associated with triad of symptoms, namely, tremor, rigidity, and bradykinesia, with postural instability. An earlier feature of Parkinson's disease is tremor, typically unilateral, meaning presented only one side, and present at rest. After using the hands, such as to pick up a book, the tremor may vanish for some minutes, only to return when the patient is distracted and resting once again. Slowness, or bradykinesia, on the other hand, is a core feature of Parkinson's disease. Patients will notice it takes them longer to do simple tasks, their walking is slower, and their reactions is compromised. Patients demonstrate an inability to tap their index finger and thumb rapidly, tap their foot rhythmically on the floor, or walk steadily. Gait disturbance is late manifestation. And flexed posture. Rigidity is the third prominent feature. Patients appear stiff, and they find it difficult to rise out of a chair without support. While walking, there is reduced arm swing. The disorder has a slow onset but is progressive. Tremor is often the first symptom and later can be associated with bradykinesia and rigidity. Before these main symptoms, prior to several years, other symptoms can be presented: loss of smell, sleep dysfunction, depression, excess salivation, constipation, and excessive periodic limb movements in sleep or erectile dysfunction. Additionally, individuals with constipation or tremor have a higher risk of developing Parkinson's disease over 10 years of follow-up. The disorder is associated with the loss of dopaminergic neurons in the substantia nigra and the presence of Lewy bodies. Most cases are idiopathic, meaning we cannot identify an underlying cause. Parkinson's disease can be correlated with free radical damaged brain tissue. Pesticides, herbicides, and head injury can be risk factor for Parkinson's disease. Diagnosis typically based on symptoms. There is no specific laboratory or imaging study that can help make a diagnosis of Parkinson's disease. Treatment. No cure for Parkinson's disease, but symptoms can be improved. Pharmacologically, this is typically levodopa, combined with carbidopa, which decreases side effects and improves CNS bioavailability. A dopamine agonist, pramipexole, ropinirole, may be started in younger patients. It may not be as effective as levodopa but will have fewer side effects. Anticholinergics or amantadine may be used if the predominant symptom to be controlled is a tremor. Selegiline is often used to treat early disease and can provide mild symptom relief. Most antiparkinsonian medications provide good symptom control for 3 to 6 years. After this period, the disease progresses and is often unresponsive to medications. In general, younger patients should be treated more aggressively than older people. A multidisciplinary approach to the management of Parkinson's disease is essential. Physical therapy is essential, and maintain an active life. Patients do well with music therapy and physical fitness programs, cycling, and boxing, sometimes dancing. Individuals with just tremors at the initial presentation tend to have a protracted benign course. Individuals diagnosed with the disease at older age combined with hypokinesia and rigidity tend to have a much more rapid progression of the disease. The disorder leads to disability of most patients within 10 years. The mortality rates of patients with Parkinson's disease is 3 times the normal population. While treatment can improve symptoms, the quality of life is often poor. Parkinson's disease is the second most common neurodegenerative disease after Alzheimer's disease, with a prevalence of approximately 0.5 to 1% among those 65 to 69 years of age, rising to 1 to 3% among persons 80 years of age and older.